So, Dr. Patetti, how does a concussion occur, and what ways does it affect the brain?
Well, so concussion can occur in one of two ways, actually. A concussion can occur when you have a direct blow to the head. So you're playing football and you have a helmet-to-helmet impact. A concussion can also occur, though, when you have an abrupt deceleration or acceleration of the head. So if you're in a car accident, if you're driving in a car and you have your seatbelt on, and your car hits something and your body goes forward fast, your head, and then the seatbelt catches you, so your head flies forward, stops, and then flies back. That acceleration of the head and deceleration, you have to remember your brain is not attached to your skull. There's actually a little bit of give. So the head goes forward, the brain slows before, the head stops, the brain smashes against the front of the head, of the skull. And the same thing happens on the back. So those are the two mechanisms generally we think about. When you have either of those injuries, the nerve cells, the neurons inside your brain stretch and tear, and the brain, or those neurons, those cells start to release what are called peptides and amino acids, and that causes a whole cascade of events where your nerves inside your brain, the neurons inside your brain don't function properly, and that's when you start getting the symptoms of concussion.
So in recent years, it seems that there's been an increased amount of awareness in sports. Is there a particular reason why this has occurred just in the past couple of years?
Well, it's an interesting story. I think that concussions have occurred forever. I mean, they've always been there. But when I was growing up, my father was growing up, people just would tell you to kind of shake it off and get back into play. And people didn't really pay attention to the long-term ramifications of having these kinds of head injuries and concussion. And to be honest, people didn't live long enough for some of the signs and symptoms, the long-term signs and symptoms of concussion to actually manifest themselves. So now people are living longer, and you're starting to see these things start to crop up as they get older, because we know that it can cause long-term injury to the brain. I think that there's been a lot of the interest really comes from the NFL and some of the high-profile athletes who have committed suicide, and what was found afterwards, was thought it was because of these brain, injury to the brain that they sustained from concussions, and so that really brought some attention to it. If you look just historically, the number of kids who are playing football or other, sports in general has really tremendously grown since when I was growing up, and I'm not that old. So that the number of kids who are playing sports has increased, and the number of kids who are injuring themselves has increased dramatically. So just that whole prevalence has gained a lot of traction on the ground.
So you have a lot of people coming to the emergency room, and you see a lot of people that have concussions. What would you believe the most common sport or activity related to getting a concussion comes from?
Yeah, so most people, when you think concussion, the first sport that they would probably throw at you or say would be football. I can tell you that in my emergency department, and actually when you look at research studies that have been performed over the past even 5-10 years, that's actually not the most common sport. Actually, the most common sport, and this is almost bears out in my ER as well, is soccer, believe it or not. So soccer seems to be the most common sport for head injuries and concussions, followed by basketball. So those two sports, and that kind of bears true in my own experience, those are the two sports that I see the most concussions. It's interesting, I was involved with youth football here in South Bay for a long time, and in probably 10 years, 11 years, I can count on one hand the number of kids, youth, that sustain a concussion. But many of my friends have had, their children who played soccer who've had a concussion during that same time period. So it's interesting. Those are sports that people don't really associate with concussions. It's also the sports that you don't wear headgear. But those are the two more common sports that we see.
Okay, so you think that this lack of headgear could result in more concussions, or?
Well, we know that headgear definitely helps. So if you're in a sport where you are at risk of hitting your head, if you put headgear on, you will definitely cut down the incidence of concussions. That's for sure. If you look we'll use football as an example. If you look at the evolution of headgear in football, it's incredible where we are today versus where they were, wearing leather helmets. We know that those helmets definitely protect the head. You're still at risk of concussion because nothing's 100%, but it definitely has had a dramatic improvement in the rates of concussion in football. Soccer, no one's going to wear a headgear in soccer. We know that a lot of concussions come from heading the ball, and so
Mhm.
a lot of my understanding about like youth soccer in particular, they're trying to restrict the use of heading until you're older and things like that, and so that seems to help. In basketball, it's really from falls. It's not so much getting hit in the head with the ball, but it's hitting falling, hitting the court and things like that. You're not gonna wear headgear probably in basketball either. So, but headgear will help, especially in those sports that have risk of hitting your head and concussions.
Trainer Rob, when an athlete comes off the field, what symptoms are you looking for to diagnose a possible concussion?
The main symptoms of the concussion that you're looking for, number one is headache, dizziness, nausea, trouble concentrating, any type of memory difficulties, balance problems. There's a bunch of different ones that we look at. But the main ones they'll come off with telling us are the headache and the dizziness. We also do some testing with the eyes further on, something called a VOMS test, a vestibular test, and we can, by looking at the eyes, once you're trained, you can really have a good idea of what's going on concussion-wise on a sideline.
After a concussion has been diagnosed, what treatment methods or recovery plans do you have for the athlete?
Technology for treatment has really advanced within the last several years. It used to be you would just kind of rest and wait till your symptoms went away and wait a specific time, like 2 or 3 weeks. But now there's much better things out there to tell where a concussion is and where a person is in their rehabilitation and recovery from it. So the first thing is an impact test, a computerized test. And that's something where we get an objective feel for where a person is. It really tells how their brain is moving. Also, there are different types of therapies out there now. Vestibular therapy, balance therapy. They can help the systems recover much quicker as well too. And there also, rest does play a part as well too. A lot of times a student will get academic accommodations to help their brain incorporate some rest so it's not taxed.
Last concussion was 3 years ago.
Mm-hmm.
How has it affected you now? What effects are occurring in the present?
Well, still sometimes light sort of gives me headaches.
Mm-hmm.
Going into real crowded spaces can overwhelm me. If there's a little too much going on, sometimes I still feel a little. I know a word used a lot is cloudy
Mm-hmm.
for concussions, so it's a real hard feeling to explain.
Mm-hmm.
It's just sort of the feeling of being overwhelmed, and maybe my senses are a little numbed.
And with these lasting effects, are you experiencing anything new, and what type of medication or treatment are you doing now?
Yeah, actually, after my last concussion, it sort of gave me onset ADHD.
Mm-hmm.
So I take something called Vyvanse now
Yeah.
that helps me focus a little more, and it's sort of hard to focus without it. But once I take that, my focus is pretty much the way it used to be.